We have Mary Stevens-Krogh here from Portland Public Schools, and she's going to be talking with us about substance use interventions for youth, looking at a support versus punishment dynamic. So I will turn it over to Mary, and please welcome her.
I'm Mary, and after Dr. Levine's intro, I'm here from Portland Public Schools to talk about what we're doing to address substance use at PBS. First thing I want to say is we have not historically participated in the student health survey. We do the youth risk behavior survey. During Dr. Levine's presentation, in anticipation of mine, I sent a frantic text to my colleague, Dr. Jenny Withacom, who is the administrator who does the youth risk behavior survey, to ask why we go with the youth risk behavior survey. I'm sure there's a good reason that I don't know about, so stay tuned. I'll check my phone periodically. Okay. So I want to encourage what I heard earlier this morning, which is to take care of yourselves, to be comfortable, and to ask lots of questions. That'll help me really make sure I'm delivering content that is relevant to everybody. Lots of times when I'm presenting to educators. And so if I go too far into the education mumbo jumbo, stop me and get me to clarify for sure. And I thought it was interesting. I think it was Kayla or Cassie that said people aren't usually in person. And I'm like, wow, okay. In schools, we've been in person and in crowded spaces for a long time. So that's a good reminder for me. So as 25 years in education, I can't help but write learning outcomes for everything that I'm doing. And so this is what I am hoping to cover and give folks some ideas about today. We're going to talk about tiered supports for substance use and what that looks like. We're going to talk about the importance of Tier 1, which is education speak for prevention. We're going to discuss the importance of policies in education. We're going to talk about how PPS has done some really innovative and exciting stuff around using discipline as an intervention. I'm going to talk some about community partnerships, which I love and spend a lot of time on in my role. And then I really want to encourage folks to look for strategies that you can take back to your work settings. So my background is I'm a licensed school social worker. I have been working in schools for 26 years. I started when I was 10, so I'm still not that old. And I am a licensed clinical social worker, and I'm the coordinator of substance use for Portland Public Schools. This is the beginning of my 6th year in that role. And it's been a very exciting role to have. It was, when I got the job, it hadn't previously existed. And I don't often deliver a lot of direct services to students and families. I tend to get involved with families that are really in crisis. So when kids are at risk of being out of school altogether and are high acuity, dual diagnosis, and we're really trying to think about where resources might be in the community, or even statewide if we can find them. What I do spend a lot of my time doing is supporting the Portland Public Schools has 3 certified alcohol and drug counselors. I support their work We do a lot with contracting with community-based organizations. I manage the contracts. I do a lot with discipline, and I help the district think about how we're going to respond to substance use system-wide. And the longer I'm in this role, the more I know that we really need to continue to invest in prevention. So MTSS is the hot and sexy thing in education right now. But actually, being in education as long as I have, I've seen a lot of things come and go. But I actually do love MTSS. It is a way of thinking about how we deliver supports to students using data. That's it in a nutshell. And so I don't really like slides like this, but I made one anyways that has a bunch of words on it. But it's a definition of MTSS. And what you want to use in MTSS is data. And the data is very different than the type of data that Dr. Levine was referencing, because what you often are looking at is very, like, student data. And you're having regular meetings and intervals when you're getting together and you're looking at that student data. So if we deliver these supports for this student, does their attendance improve? Do they have less time out of class? Are their reading scores improving? And so MTSS is a model that can be delivered for anything: reading, math, behavioral expectations. And what I have worked on over the last 6 years is thinking about how to apply this model to substance use supports, which is the thing that I'm responsible for at PPS. So this is just a graphic talking a little bit more about the MTSS model. In Tier 1 is, what do we want all of our students to get, and how do we want them to get it? And so making plans about that at the beginning of the year, district-wide, buying curriculum, doing those types of things to ensure all of our students are getting it. Tier 2 is about targeted supports. So if we're doing a specific reading curriculum and we notice that there's this handful of third graders that still aren't reading in the way that we hoped they were, how are we identifying those kids? And then what are we doing to help them get up to grade level? That's kind of MTSS in a nutshell. Tier 3 is about intensive supports. So for drug and alcohol, the thing that is in Tier 1 is prevention, education, staff training, consistent messaging, and common expectations. So the prevention education in Portland Public Schools is actually kindergarten through 12th grade. And so when people ask me, like, oh, you're doing, and it is, by the way, what my colleague Jenny Withicum is in charge of. I am not in charge of the prevention curriculum for the district, but I do have a responsibility to know about it and to understand it. And so what prevention looks like in Portland Public Schools is that in second grade, that's the first time we start talking about substances. And what we talk about in second grade is taking medication safely. And who do you get safe medications from? And why is that important? That's the first time we talk about being safe with substances. The next time we talk about it is in fourth grade, and we talk about alcohol in fourth and fifth grade, because alcohol is a substance that is ubiquitous in so many homes. Marijuana is a close second in Oregon. We do the bulk of our prevention education in PPS in grades 6th, 7th, and 8th. And we use a skill-based curriculum. And so what a skill-based curriculum means is we don't spend a lot of time using kind of the techniques from DARE, which actually over time the research has shown that increased drug use, because it made kids curious about all these substances. Yeah. So we know more, so we're doing better. And what skill-based looks like is decision-making skills. How do you say no if you need to? Who are the safe adults in your life that you can talk to if you're struggling? How do you regulate emotions? Dr. Levine talked about that. Being able to do that is an important protective factor against substance abuse. So those are the things that we really focus in on in middle school. Yes, we certainly talk about some of the substances, but we're really focused on skill-based lessons. We also do a big piece on media literacy because vaping products are being marketed to our middle schoolers. Nobody's trying to sell me vape pens, but they certainly are trying to sell them to 12 and 13-year-olds. What targeted interventions look like is when we first start to notice that our students are struggling, and a lot of times in school districts, that's through a discipline process. So when we first notice that, how are we getting kids to that right level of care? What structures does the school have in place to consistently talk about kids who may be struggling? And so I can really go down to education mumbo-jumbo rabbit hole right here. But a good system looks like teams coming together in schools at least 2 times a month to talk about the kids that they're worried about. And they're moving quickly through students. They're reviewing data. They're looking at attendance, discipline, any other things that they're worried about, and they're making sure those kids are getting connected to the right service providers in their building. The third level in a tiered approach is connecting families to outside resources. And so one of the things that I have to do a lot in my role with my district colleagues is temper expectations and say, you know what? When kids need intensive outpatient or residential treatment, we should not expect the school district to be able to meet those needs. We provide a very low level of treatment in school districts, and our role with kids that need residential or higher levels of care is to identify them and walk alongside their families while they navigate those systems. So for most of this talk, I'm not going to focus too much on Tier 2 and Tier 3. I'm going to focus a lot on Tier 1 because I think that most people in this room are not in education, and I think Tier 1 is a really important place for our community-based organizations and partners to be partnering with schools. I love this scene because, you know, as I'm not telling anybody in here anything new. If you're in healthcare or mental health care, we wait for people to be in crisis before we do anything about it. I think in education, since we have almost all the kids, hopefully, we have a unique opportunity to get upstream of some of these issues. So in education, I think we have unique opportunity to do Tier 1 strategies. And so certainly it's the health curriculum that I just mentioned. But sometimes when I'm meeting with schools, I'm talking to them about doing just really basic things. Like, have you told your students and families what the drug and alcohol policy is and what your expectations are around that? Because just telling them that helps people meet those expectations. And alongside of telling them what the policy is and how they can get in trouble, which is how many of those conversations go, let's make sure we tell them what resources we have in our building. Because what is happening in the school districts in the metro area is a number of them have CADCs. And I just got an email The Ben LaPine School District just hired a CADC, and that person found his way to me and sent me an email. So it's happening in Oregon, which is really, really exciting to me, and it's really important that we're being consistent in telling our students and families about those resources. I'm trying to see if this is, a lot of this stuff is very specific to educators. And one thing that I do with educators is really get them to articulate what they're going to do about substance use. Decide which administrator is going to respond to discipline. Decide how and when you're going to talk about kids who may be struggling. That's how we get in front of kids having discipline. Some more Tier 1 strategies that I like to share with everybody, and these are both hyperlinks in these slides. So during the pandemic, I was talking with, when we were completely on lockdown, I was talking with my colleague Claire Rajul, who is the addictions prevention coordinator. Well, she's the manager now for Multnomah County. And I told her one thing that had been really missing in my work that I felt like I hadn't had time to do was to have student voice speak into how I deliver substance use supports to the district. And so Claire agreed to come alongside me, and we did a virtual student leadership group for a year and a half during the pandemic. Those kids were amazing, and it was such a bright spot for me while being stuck at home. And it was very interesting what these kids came up with. First, they did a survey through social media, and they tried to reach out. They represented different high schools. They tried to reach out to as many of their peers as they could and get their thoughts on what the district could do better about drug and alcohol supports. And then from that and lots of conversations, they virtually, we did this all remotely, we made a 30-minute video. I know 30-minute videos are really, really long to show to staff meetings and share with folks. And so how I really encourage schools and others to use this as a resource is to view it and see which 10 minutes of student voice resonates the most for you and your organization, and bring that back to a staff meeting, because what these students have to say is so powerful. The other thing that I created was the Healthy Choices Bulletin. I started this right when I started my role because I noticed right away that I was on all these mailing lists and I was getting all this information, but it was stopping at me. And so I made the Healthy Choices Bulletin, and my target reader audience for this are the district's counselors, social workers, school psychologists, and administrators. And what I do every month is try to pull together some of the best resources that I'm finding around substances, and then encourage them to cherry pick from that and put it in their family newsletters, which all principals are required to write. And so this is also a hyperlink, and what it hyperlinks to is the archives of the Healthy Choices Bulletin. That sounds really fancy. It's a Google Doc. It's not that fancy. But you can see all the things that I've collected over time, and if you're looking for a really specific resource, it's there. The other thing I'm going to say to this group is if you have something that I need to be sharing in this, please reach out to me. The other thing that I spend a lot of time thinking about, and this is such an important place for partners, is, I think, one of the most critical places of Tier 1 supports for schools when we're doing mental health or substance use supports is thinking about how we help families, what skills we share and give to families, because that's where our kids are. And it's easy in schools, I think, sometimes for staff to take on a little too much responsibility, but ultimately we want to skill up our families so that they can be the strongest protective factor in their kids' lives. So one of the things that Claire and I talk about, she's, again, the addictions prevention manager, is we talk about ABCD. And we share that concept with families because it's easy. And we talk to families about feeling empowered to advocate for their children, to set boundaries with their children. That's actually part of good parenting, to keep the connection. And the other thing we talk to them about is sometimes doing those things is uncomfortable as a parent. It can be really awkward. I tell this story. I have twins who are now 19, and when they were 17, they're boy-girl twins. So my son's girlfriend's dad was throwing the cool party after senior prom. And it was an all-night party. I'm like, And so my kids are like, Mom, please, 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 please. You can't even say no. Well, And then it was weird. I wasn't friends with the girlfriend's dad socially, but somehow he ended up at my house. I don't even know why. He says something to the effect of about the party. He's like, yeah, all the kids are invited to my house. He goes, I'm going to be the cool dad for this prom. And I'm like, the kids were all standing around, girlfriend and both my twins. And I'm like, but it's like not cool dad serving alcohol or anything else, right? And I felt really awkward saying that to him because I didn't have a relationship with him. We weren't friends. And I could feel the lasers from my daughter's eye going into my back. And he said, no, I'm going to get it catered by Taco Bell. And my son was like, that's great. I'm like, okay, you can go. You can go to the all-night Taco Bell catered party. But I share that example with families a lot because I felt super uncomfortable. I almost chickened out in that moment about talking to Andy about whether or not there are going to be substances. But I'm like, I gotta know because just because they're hanging out there all night, I don't want you to serve White Claws, So, yeah. So anyways, that is an example of feeling uncomfortable. The other thing I do a lot of, and these are all hyperlinks to, is I really look for, so if you all have them, send them to me, and try to share out the resources in our community that are free or very low cost. I really emphasize those. I know that families have to do a lot of systems navigation with their insurance to find things that are covered, but in terms of what I'm sharing out at a district level, I really focus on the things that are free. I think it was the second year I was in this job, I went to a field placement fair for the PSU School of Social Work. And I had this, I didn't have a person, but I had a description of the social work student that that I envisioned being the perfect person in a field placement with me. And it would be a second-year person that was, a strong writer and super interested in policy. So I table at the field fair, and all these social work students come up to me, and I'm like, there's no direct client service in this role. We're just going to be working on some different policy initiatives at the district and thinking about discipline. You were like, bye. I didn't get one taker. I got no one. I think it's funny, but I also think it's telling, and I also think it's a little worrisome, because without the policy piece, behavior doesn't really change in systems. And I'm trying to remember back to when I was in graduate school, if I made that connection all the way. It was a long time ago, but it is really, really important. And the older I get and the longer I'm in systems, the more passionate I am about making systems work. And so one of the things that PPS decided to address early on when I was in this role, and myself and a colleague who is does my role, but with all of the discipline. His name's Dana Reamer. We got tasked with leading a group to update the district's discipline policy around substance use. Part of the reason that we started with discipline, as I mentioned earlier, in school districts, that's the primary way kids are often coming into drug and alcohol supports. For example, there are two ways you can refer students to substance use supports in Portland Public Schools. One is a staff person can make a referral. Those are almost always discipline related. Or I have another portal that is very similar questions, but a little bit a few less questions, and families or students can make a referral. Last year, about 275 staff people made referrals, 20 parents and students made referrals. Self-referred, initiated the services themselves. So it's pretty striking. And so since most of the students are getting to us through discipline, we wanted to look really hard at our discipline policy. And so this is a map of the US, it's a map. And what it shows is the disparity, the likelihood of the disparity between Black and white students for all discipline. It's very difficult to find substance use discipline that is separate. Districts tend to report all of their out-of-school discipline, which means suspensions and expulsions. And so the darker the color on this map, it means the bigger the disparity. And so what this map means is that in Delaware, if you're Black, you have a 68.4% chance of being out of school for discipline. 68.4% greater chance of being out of school for discipline than if you're white. Very, very concerning. So Delaware's got a lot of work to do, as do North and South Carolina. But we don't want to let Oregon off the hook, and our disparity rate in Oregon is 15.4%. And Dana and myself and other people within our district decided that we could do better on that. So this is another slide with tons of words. At the top is a link to the policy that our district ended up with after a year and a half of work. It takes a long time to update a policy. We worked with a lot of community-based organizations to get our policy updated. We worked with administrators. We worked with people that were in athletics in the district because we wanted our new policy to be something that would really stand the test of time. And we got some really great advice from Multnomah County's Tobacco Prevention Office, and we started working with them because, so it was 2018, so fentanyl was not really on the scene yet, and it certainly wasn't on the scene for students. And so when I started this role, what principals were losing their minds about, taking the outside doors off of bathrooms about, was vaping. People were going crazy with vaping. And we didn't, at that time we had a drug and alcohol policy, that's what it said, and a tobacco policy. So what we spent time doing with the help of the Tobacco Prevention Office is merging them. And the reason we merged them is in Oregon, you have to be 21 to legally use any of those substances. The other great advice they gave us is to write a policy about what you do want, not what you don't want. So our old policy was written about drugs and alcohol. We don't want that. What we do want is healthy, substance-free learning environments for everyone. And we're talking about games, field trips, anything that you do that's related to the school district. We want it to be substance-free. It applies to adults. It applies to everybody. And we want it really focused on what we do want for our students, which is wellness. If you're totally into policies, you can read through the whole thing. It's short in terms of policies. It's only 9 pages long. The other thing that we did is we took a lot of the discipline out and instead replaced it with interventions and supports. So now when kids get in trouble, the primary thing that is going to happen is they're going to get attached to some psychoeducation or some counseling. The other thing that we did is we eliminated expulsion for addiction, which was not explicitly stated in the old policy, but that's the result. So basically, you can have unlimited drug and alcohol violations. We're just going to keep coming back to the table and thinking about what interventions and supports you need. You can be expelled for repeated violations of distribution. You can get yourself there if you sell drugs on campus enough times. Yeah. The other thing we added in is myself or somebody from my team. Once kids start to get in trouble 3 or 4 or 5 times, which doesn't happen often, someone from my team has to be in those discipline processes. And we go as the thought partner with staff and families about what supports might be available. Because obviously, if kids are getting in trouble 3 or 4 times, they've gone from experimenting into addiction. And so we want to be really thoughtful about where we're connecting them. The other thing that was in the old policy is that we used to suspend kids from sports or theater or choir or whatever for 28 days. Well, in the school world, that's the life of, a sports season for many sports. So we work with athletics and we got it to 14 days. And the thing that we also were able to change is students can continue to go to practices. They can't participate or dress out for games. Or if there's the theater production, they have to sit out from the theater production. The other thing that we really highlighted and emphasized in the policy, it was kind of in the old policy, but it was really easy to miss, is that when students self-disclose, they're exempt from discipline. Discipline stops. So That means that even if they come into school and go and talk with their school social worker and say, Miss Brittany, I'm here and I am high. Or Miss Brittany, I'm here and I've got a joint in my backpack and I wish I didn't have it. They're exempt from discipline. We need to respond to them with interventions and supports, but there's no discipline process. I'm going to pause there. Does anybody have any questions about that?
Thanks. I'm curious, you mentioned psychoeducation being a part of like one of the first interventions that you have. And I'm curious if as part of that psychoeducation, you're talking about the pleasure associated with some of these things or the reasons why someone might be using them, not just the negative outcomes or like why you shouldn't be using tobacco, alcohol, or marijuana.
That's a great question. So the primary intervention that we do for students that have the lowest level substance use violation is a class called Insight, and I manage Insight, and it's 6 hours of psychoeducation spread out over 4 Wednesdays, and students are required to come with a parent or a caring adult, and over those 6 hours, we really focus on the 3 substances that students get in trouble for the most in PPS, which are all the legal ones: marijuana, vaping, and alcohol. We talk about dopamine receptors and that cycle in the brain. We talk about how to access more counseling if you need it. We talk about adolescent brain development and why sleep is important, why positive recreation is important. Those are the kinds of things we talk about. Mm-hmm. Does that answer your question?
Yeah, I was just thinking about like when we talk about like sexual health, for instance, we talk about the benefits or like why people choose to have sex earlier, why people choose to engage in sex. And I don't see that same kind of thing for drugs and alcohol. Not as a way to encourage folks to do those things, obviously, but as a way of talking about like why older folks do them, people that are, have full brain development do them, things like that. Because there might be a reason why a young person might say, this is doing something for me that I'm not able to get in some other way. And so talking about, are there other ways to meet those needs?
I think we do in a little bit more roundabout way in that we talk about healthy coping strategies for stress, because a lot of youth, when they're in front of a certified alcohol and drug counselor, are talking about stress and using as a way to cope with stress. So we talk about coping with stress. We talk about the importance of connection in families and connecting and a sense of belonging in families. We talk about risk and protective factors and what protective factors people could consider adding or increasing. So, yeah. Plus, we talk about dopamine and the addiction cycle. Yeah.
I'm assuming harm reduction is just off the table in this population, which I can understand. And then also just, perfect. It's like I segued into it. And then when does the school resource officer involve in this at all? Like when does it become a situation where there might be some type of legal matter? And then how does that intervene with the treatment that you're providing?
Thank you for asking me that. Currently, Portland Public Schools doesn't have school resource officers. We had a contract with the Portland Police Bureau that was ended, and it was ended during all of the things that followed George Floyd's murder. It was political, there was a lot of emotion around it, so we don't have school resource officers. Last year, the Police Bureau wasn't called for any drug or alcohol violations. I think first of all, if we called them and said, hi, we caught this student and they had like a little tiny bit of a joint left over, they'd like hang up the phone on us. I think the only time we would be in touch with the police is if we felt like our students were being used to traffic large amounts of substances, being used by adults. Or I think if we happen to catch a student with an unusually large amount of a substance. Yeah. But for the last 2 years, actually, the police haven't been involved. So.
Have you noticed a benefit to that or not a benefit to that?
Well, he's asking if I've seen a benefit to that. I think the huge benefit is, so we call the process hearings, and that's interwoven throughout all of the district's discipline policy, but it's not a legal proceeding. The benefit to it, I think, is only using police as a very last resort with very large safety concerns is we're trying to interrupt the school to prison pipeline. And so by not having police involved, our students there's no legal charges associated with anything that they're doing. The other thing that has happened in Oregon over the last few years is the police have in general really backed off from charging adolescents for drug and alcohol violations, even out in the community. They're just not very likely to do it unless, again, trafficking large amounts of substances. Yeah. Okay. Okay, go ahead.
Oh, for maybe in the back. Okay. I was just curious about kind of what metrics PPS is using to measure the progress of the new policy, and are you hoping for fewer suspensions or increased academic performance? Like, what are you all looking at long term as far as the data goes?
Well, the immediate thing we're looking at is not so much that we're decreasing discipline interactions, because discipline is a way that we can connect students to supports. But then once they have a discipline intervention, does the behavior change? So by offering interventions, education, support, does the behavior change? So one of the things that we look at is for the number of students that have a level A, which is the lowest level of an intervention, what does that do to kids that go on and have a second or third violation? That's what we're looking at. And we're super focused on reducing the amount of out-of-school discipline. We want to get as close to zero on that as we can. Because if you get in trouble for smoking pot and then you get suspended, great. Now I can smoke pot and play my Xbox more. And there's no expectation that I'm at school. I can't even go. So we're really trying to move away from that. Yeah.
Thank you.
Okay. So I'm running out of time. This always happens to me. So we're going to talk a little bit about what the school district, can we come back to you?
Yeah, I just had a super general etiquette question. Can I take pictures of these slides?
Oh, I think they're in the base camp, right?
Yes, correct.
Mm-hmm. Yeah. Mm-hmm. So Portland Public Schools does practice harm reduction, and I'm going to go quickly through these slides. What I spend a lot of time talking about with my colleagues is what harm reduction looks like with youth. And it needs to look a little different with youth than it does with adults. And so I have staff talk to me, counselors and social workers mainly, and from a place of frustration. And they're like, we can't even practice harm reduction. And I'm like, well, tell me what that means. I mean, if you mean, can we have kids come to school high? No, we probably can't. That's not a safe learning environment for them or for their peers. So yeah, we're not going to probably do that. But we do have all these other things that we can do to help kids on the path towards recovery and wellness. And I really want to empower the counselors and the social workers and invite you all to partner with us to bring in more resources into our buildings, because I think the most important thing that school staff have a ton of power in is relationship. And often kids are identifying a teacher, a counselor, a social worker, their CADC as one of the most important adults in their lives. And that can be a place of really great information. And so I try to bring folks back to that. Some of the system-wide supports that PPS is using is that we do have Narcan in all our buildings. It's there as an emergency medical intervention. We don't dispense to students, except in student health centers. And they are part of either Multnomah County or OHSU. You can get it there. You can see a nurse or doctor there and get it. All of our CADCs, our contracted providers, and our district staff are trained in our principles of harm reduction. We have a discipline policy that supports self-disclosure. So by that, you know what I mentioned earlier, kids can talk about needing help and wanting help, and there's no discipline attached to that. And then I have my work cut out for me continuing to train staff in what is available to help minors. I'm going to say that none of our work would be possible without our partners, and this is just a few of them. I'm also here today with my trusted partners and colleagues from LifeWorks, and they're a really important partner. And I should have Multnomah County on here as well. Multnomah County just partnered with the district, and we gave out drug elimination bags to all our 9th through 12th graders in the district at registration. So, I mean, we wouldn't be able to do this big lift without this. And the last thought I want to leave you with is I'm in a really unique role. I haven't met anybody in the state, and I'm looking for a me nationally that has the luxury to just focus on the system level work for a school district, and I'm super aware of that, and I love it, and so I invite others to just cherry pick from all the work that we've been doing and take these ideas back to your organizations. It's a lot, and most people don't get to spend as much time thinking and doing this stuff as I do. That's it. Questions? Thoughts?
I have 2 questions, actually. One of them is, do you know which schools have a CADC in Portland Public Schools?
All of our high schools. We have 9 comprehensive high schools and 2 in-district alternatives. Those are the Alliance campuses. All of our CADCs are spread across several high schools. Yeah, they're not just 5 days a week in one high school.
Okay. Are you guys looking to add any to the middle schools? Because based off the research that we just had, it seems like it should be starting in the middle schools more so. I also work in a middle school, so.
We are. There's some complicating factors with middle schools. First of all, we have 11 high schools, but we have 24 schools with grades 6 through 8. The other thing that happens, because we have some K-8s sprinkled in there, the other thing that happens with middle, so at Grant High School, honestly, if we had the staffing and the funding, we could have a CADC there 5 days a week, and they would have a full caseload. There's 2,200 kids there. It's not, nothing disparaging about Grant. It's a big high school. They have a lot of needs. That doesn't happen at middle schools. The majority of middle school students are not using to the level generally that they qualify for 1.5 or higher on the ASAM. And so then what you have is somebody that needs to be super mobile and get around all the middle schools. And then there's the challenges with scheduling, you know. So yes, we do spend time thinking about how to better serve middle schools. We've sent CADCs to middle schools, and it's hard. A lot of logistical things with that.
Real quick, I understand that Emma is not at Grant right now or on leave. Is there going to be someone that's going to take? Sorry, is somebody going to be able to take Emma's place? Did I hear that correctly?
Do you work at Grant?
I work at Multnomah County, but I also do I just launched a parent group using craft and invitation to change for the 4D Youth Center. So
Awesome.
yeah. But through a parent, and I learned that Emma's not going to be at Grant, and I understand the needs. I do know the needs are great there. So is there going to be someone that's going to be able to step in her place while she's just?
Yes, we did some
Okay.
shuffling.
Right.
Emma Sarayakoff is the beloved LCSW CADC that is at Grant. She is a fabulous clinician. She's on a family leave this fall. And Elijah Joshua, who goes by Uncle E, who is just an enigma in and of himself, is at Grant in Emma's absence. Yeah. Yes.
Respect your goal. I was also curious, like going way back to that slide that you showed with like all the different percentages of those that are being disciplined, specifically white versus black students. I'm wondering if that percentage was compared to the population percentage of black students or black people in Oregon, because it seems like I'm wondering if that would be the same percentage or if that was compared to it at all. You know?
That's a good question. And I think, what you're getting at is it's probably greater than what that percentage represents because we are a predominantly white state. So, yeah, that's a really good question.